Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Naraina Kisina binti Al-Khairi and my matric number is 1202762. Today, me and my group members will present about what we have learned from the interview session with activeotak.com about autism. Okay, the introduction of Active Otak Clinic. The person that we have interviewed is named Muhammad Ahmad Ibrahim, and he is a consultant for Active Otak Clinic. He is currently working as a consultant at Active Otak Clinic after receiving a certificate in neuroscience of autism. He joined the Active Otak Clinic after his third daughter was diagnosed as having developmental problems, affected by speech delay because of too much exposure to gadgets. As he witnessed his daughter's developmental improvement fast after he consulted at the Active Otak Clinic, he became interested in the field and began to get involved with the Active Otak Clinic. Okay, next, Active Otak Clinic has 18 years of experience in special children's IQ development. The clinic conducted R&D in early education for 3 years before it was produced. It became certified brain training in 2015 and continues to progress to this day. There are a variety of programs that Active Otak provides, such as Active Therapy, which is for kids with learning disabilities, dyslexia, ADHD, and slow learners. Definition of autism. Autism or autism spectrum disorder, ASD, is a neurological and developmental disorder that affects people interaction, communication, learning, and behavior. Although autism can be diagnosed at any age, it is classified as a developmental disorder since symptoms often arise in the first 2 years of life.
Okay, there are a few general symptoms of autism, which is social communication and repetitive behavior. So first and foremost, social communication refers to making little or inconsistent eye contact during the interaction. So during the interaction, there is no eye contact. Also, they are appearing not to looking or listening to people who are talking. For example, if we call him or his name, they might not respond directly. And they are hardly playing toys in the right way. For example, they tend to arrange cars in a long line, or they only playing with the tires, and also difficult in making friends. Next, for repetitive behaviors, that refers to repeating words or phrases, a behavior that called echolalia. They can shout over and over again, repeating the same words over and over again, or clapping their hands in front of their face.
There are three factors of autism. Firstly, genetics. Autism tends to run in families. Changes in certain genes increase the risk that a child will develop autism. If a parent carries one or more of these gene changes, they may get passed to a child, even if the parent does not have autism. Other times, these genetic changes arise spontaneously in an early embryo or the sperm and egg that combine to create the embryo. Again, the majority of these gene changes do not cause autism, but by themselves, they simply increase risk for the disorder. Secondly, environment. Air pollutants play a role in triggering autism spectrum disorder. Early life exposure to air pollution may be a risk factor for autism. Children of mothers living near a freeway and traffic-related pollution during the third trimester of pregnancy were twice as likely to develop ASD. Pregnant women who are exposed to certain drugs or chemicals like alcohol or anti-seizure medication are more likely to have autistic children. Other risk factors include maternal metabolic condition such as diabetes and obesity, a metabolic disorder caused by the absence of an enzyme, and rubella. Thirdly, unhealthy eating habits. Unhealthy eating habits of pregnant mothers, especially in early pregnancy, may increase the risk of having a child with autism. Pregnant mothers who are not taking any multivitamins with or without additional iron or folic acid will more likely to have a child with autism and intellectual disability. Children who are exposed to an unhealthy eating style may also become autistic at a very early age. Children are given processed food, fast food like Maggi and high sugar foods that can lead them to autism.
Based on the interview session, the panel explained that autism can be treated in 3 ways, such as occupational therapy, messaging and bandaging technique, and also in Islamic ways. The first treatment that the panel said is occupational therapy. An occupational therapist helps people improving their handwriting, improving their fine motor abilities, and daily living skills. Occupational therapy is also encouraging, maintaining, and improve kids' skills so that they may function in school and beyond, such as self-care, productivity, and leisure. However, the panel mentioned that occupational therapy is only focusing on patients physically, not mental. The second treatment that mentioned by the panel is messaging and bandaging techniques, an efficient method for ensuring that the physical status of the skin is normal. This may be accomplished through messaging. Any physical elements that cannot be noticed by one's own body can be treated with this procedure. If the children's head structure is not typical, such as a lumpy or bloated head, they will frequently endure headaches, migraines, and a lack of attention in school. After the bandaging and messaging are completed, the blood flow in the body will return to normal, and the injuries mentioned above will be prevented. Last but not least, the panel also mentioned that autism can be cured or can be lessened by Islamic ways such as ruqyah. Ruqyah helps make autistic children less aggressive in behavior. Furthermore, the recitation from several verses of Quran affects kids with autistic brainwave. Thank you.
In conclusion, there's no way to prevent autism spectrum disorder, but there are treatment options. Early diagnosis and intervention is most helpful and can improve behavior, skills, and language development. However, intervention is helpful at any age. Though children usually don't outgrow autism spectrum disorder symptoms, they may learn to function well. Religious perspective also affect parents' child-rearing goals and practices, in which parents view the developmental disorder faced by their children as a test and challenge to their own spiritual and moral qualities, whether they could be caring and patient enough in accompanying and raising the child to achieve his potential. And in the end, it impacts on their beliefs and behaviors in treating ASD, which eventually drove parents to choose alternative options for treatments and medicines, alongside treatments and medicine prescribed by health practitioners.